Hi everyone, welcome to another episode of Circle Direct Podcast, where we discuss all things health and wellness. On today's podcast, we'll be having two hosts, myself and the delectable Dr. Tiwa. Dr. Tiwa, say hi.
Hi, good day.
Yeah. So on today's episode, we are discussing all things allergen. We're going to be talking about allergy from a doctor and a pharmacist perspective, and also our shared experiences. I want him to just explain to us what allergies are.
Okay, thank you very much. So allergies for me are situations where the body reacts negatively to things that typically do not cause harm. For instance, food, medications, the environment, like pollens, which are typically beautiful in the atmosphere, but to the wrong people might cause some reactions. Things like rashes or itchiness of the skin, um, watery eyes, for instance, sniffles, like that way. So that's what allergens are for me in this sense. So.
Okay. The another thing I wanted to just discuss is from a doctor's perspective, do you feel that we are sharing, is there much awareness on allergies, especially in our location in Nigeria?
No, I don't actually think there is any awareness, as the case may be, regarding, because allergens are it's not something that has that effect on the Nigerian psyche, because Nigerians, the way we take um, health is as its infancy. Like, it's not something we take too seriously if it is not something that affects us dramatically or negatively. And the way allergens work, people never really see the need to have any information about them, because if I can give an instance, if someone has an allergy to seafood, for instance, if I don't
Yes.
eat seafood for the entirety of my life, I would never know I have an allergen. So most people feel like, since I do not have anything like that, or I've not had any negative reaction to all these things, then why should I feel the need to study about them? So that is why there's not much awareness. But at least today we're going to see and share with them what we know from our perspectives, to make them understand that this is an important thing that they need to know, as the case may be. So.
Okay. Now, something else that just came to my mind is, when it comes to allergies, is it gender specific? Does it affect a certain age group? And then is this something that one will live with for the rest of their life, or when they get to a certain age, they outgrow it?
Well, in my experience, it's not gender specific, it's not age specific. It can affect anyone, anytime, any gender, as the case may be. And so far, it's been something that affects for very, very long periods of time. But the thing is, it can be easily managed, because the way allergens are, if you avoid that thing, you do not get it. So, for instance, in the medical field, we usually have a question we ask most of our patients: do you have an allergen? Do you have any food allergens? Do you have anything that you're allergic to? Do you have any medications that you're allergic to? Because we do not want to inadvertently make your condition worse, as the case may be. Because when running a hospital, for instance, you give patients food, you give patients medication. So you have to know what the patient is allergic to, so that when you don't give them something that will cause harm. So it's not gender specific. It's
Yeah.
not.
In fact, there's something that I just want to raise. I remember very well, there's a patient that I attended to that I was going to give prescriptions to. And the patient now mentioned to me that he hopes that medication doesn't contain any dairy. And I said, why? He said, because he's allergic to dairy. And then I was intrigued that, okay, you're allergic to dairy, but does it mean that some products, especially medications, do they have dairy included in them? And so because of that, we now had to check the package. And we saw that on the package, it wrote there on the label that it doesn't contain any allergen. So have you ever had any experience with patients coming to you, maybe during your consultation, that, okay, they made you know that, okay, this certain drug, are you giving them this drug? Because we've had cases whereby, I don't know, there's this syndrome called GPS phosphate syndrome, if I'm correct. Or there's a particular, if I'm, maybe,
I know
yes.
I know what you're talking about, yeah.
And then there's one that's sulfur
Yeah.
sulfur group. So
Yeah.
cases like that too in the medical line.
Yeah.
Have you ever had patients that or the parents will meet you and say, my child doesn't, whatever you're going to prescribe, my child doesn't have
Take
And then how were they able to discover that the child even had that allergen?
Yeah, so in terms of experience with allergens, the one that I'm familiar with is with the child, like when parents are speaking for their child. So the thing with discovering an allergy is usually accidental. It's usually accidental. So they had initially gone to a hospital for their child when the doctor gave medication, like a pain medication that typically was supposed to work, but then it had a negative effect, which was dramatic. There's some people that have very dramatic allergic reactions where they might swell up or they might just start screaming or feeling like burning sensations. There was this when I was doing house job, there was this doctor at the time. So she had exhaustion and we just wanted to give her some medication. She had like fever and everything. So we wanted to give her some antipyretics. That's fever drugs.
Yes.
That's what I mean.
Yes.
So she was not fully conscious as the case may be. So we just gave her the medication only for like 10 minutes later for her to like almost an ICU case.
Wow.
Almost an ICU
that means like
case.
she must have had like an anaphylactic
reaction. Anaphylactic reaction to that. So that's why it's accidental. And that's what we need for people to be aware, because it can be accidental and you have like minor reactions to it, like, oh, I'm itching all over my body, it's a bit uncomfortable, can we go to the hospital? It can be those kind of reactions, but it can also be something that could be life altering. Because if we didn't catch it, like there were a lot of things that had to be done for her to stabilize, for the doctor to be stabilized immediately. If not, it could have been a really bad case of her just passing on. And that would be our fault, because
we didn't ask.
We didn't ask whether we just assumed that okay, we're giving a fever drug.
Yes, she can't possibly.
Yeah, she can't possibly be allergic to fever drug. That's why medical practitioners also have to do due diligence when it comes to allergies, because when you are taught, there's this thing with questions that you ask your patient when you want to know something about the ailment they have. When you're taught, allergy is, even though it's important, it's not one of the crucial questions. The way it is taught anyway, it's not one of the crucial questions to ask. It's just a
surface thing.
Because every time you ask, do you have an allergy? Everybody says, oh, no. So because of how monotonous it is sometimes for a medical practitioner, they might want to be like, this person might not have allergic reaction, so there's no need for me to ask. So that is an error. And in our practice, making sure that you do due diligence and go over everything is important, because the one time you don't want to have one time where you make a mistake like that with allergens and it becomes something that follows you throughout the rest of your career.
Yes.
So that's why I just feel this is really important. This conversation that we're having is really important regarding this. So it's an accidental discovery. That's how the parents of the child knew. So that's why they told us, oh, please, I hope you don't have, what do you call it? Pain medication. That specific pain medication. I hope that's not the pain medication you want to give this child, because it has a poor reaction to it.
Yes.
You understand? So that's just how it is. That's just how they figure it out. There's no, well, now we have, tests that can prove, but people don't go to hospital saying, okay, please, can we do this test to find out which kind of allergen I have? People rarely do that. So we're advising they do, but as of right now, never really come across any patient that's come and said, okay, please, I just want to know the type of allergens I have, so that I know what to avoid. Most people just go through their life not knowing what they should avoid.
So from everything you've discussed, it just made me realize the role medical doctors are playing in raising awareness for allergies. Because something just dropped in my heart now. There was a case of a child that had an allergy to seafood. And they went to a restaurant, and unfortunately they asked questions. That is the food, is it free of this, free of that? Although the restaurant said it was, but unfortunately there was a cross contamination. So because there was a cross-contamination, the parents were not made aware that even a cross-contamination can still be fatal. And unfortunately, the child took a meal that had been cross-contaminated with seafood. It wasn't as if the seafood was prepared with that meal the child asked for. And that day they had a shot. This is it phenylephrine?
Okay.
The shot that they normally give to calm down the immune response. No, not hydrocortisone. It's I think it was not adrenaline. One of these injections. No, it's not phenyl. It's a flu. It's a shot actually. So they normally carry it around especially when they go traveling. But unfortunately, even when they gave the child the shot, the child still passed on because the airway, the throat had already swollen up. So the child was gasping for air before the paramedics came in. This is not Nigerian. It's foreign. It's like Europe, I think. So the child passed on. So I'm now seeing that even doctors, they have a major, because most times when it comes to medical information, patients really take any information a medical doctor tells them. They take it strongly than just a passerby or someone that has a similar experience. And another thing I realized that a lot of people might have allergies, but because they don't even know what they have is an allergy, they just think maybe it's, some people will say, like, let me say, I mean, we are in Nigeria. Sure. There's something they might call the blood is dirty. We are very, the way people think, and they'll be like, okay, maybe if they take a tonic that will wash their blood, maybe to wipe away all the dirt, not knowing that there are some things that they are taking, or even there are some things that are applying on their skin that is encouraging these allergens to keep on coming. Then, can we even discuss more on the abuse of some of these corticosteroids for people that actually, one of the things we realize is when people have allergens, they don't know they have allergens, but when they have the skin rash, they keep applying corticosteroids on it. So can you just like enlighten us more on like, okay, now that you know that, okay, when I take a steroid, it works, but the abuse of it, the harmful effects it can have on you.
Okay, so before I go about this story, I want to first preface it with saying that I don't really want to scare anybody with the corticosteroid application. So the thing is, a lot of creams, a lot of all these topical ointments and everything, they have like corticosteroids on them. Yes. So a lot of the time, people don't go through the contents on the bottle to check, okay, what is inside here. But it's clearly stated there to save them from any litigation or from any legal cases. But you have to check to see if they have corticosteroids, because corticosteroids are not super important for application of creams to make up all these topical ointments. So in terms of abuse of them, there's a story of this lady that unfortunately passed on. So she used to use a lot of topical corticosteroids, apply them everywhere, apply them on the face, on her body and everything. The adverse effect of this is that they start affecting your kidneys. So your kidneys cannot take away all of the harm that you are doing, cannot completely take them away. And your kidneys are really efficient. They're able to take away any damaging substances out of your body, typically. But the more you put on these corticosteroids, of course, you have to use a huge amount, like this lady did. So the problem is when she came to the hospital, she was already in very bad shape.
And this was because of excessive use of corticosteroids.
Yes, excessive use of corticosteroids. It got to a point with this lady. She developed what is called a mucormycosis of the face.
For our viewers.
Yeah, I don't want anybody to go on Google to search what it is, but it's a graphic condition. Like, it was so graphic. Like, we had multiple consultants come to see it, because it doesn't typically affect Africans, sub-Saharan Africans. It does not typically affect them. But to describe it is basically if you have this white indentation across your face to your nose, it's almost as if your face is decaying inside. So it's for her, it was a big graphic. I don't want to go into too much details, but it's just it was so unsettling for most of the doctors that they were wondering if it was what we were giving that was causing that for her. But it wasn't. It was mostly progression of the disease, because I reached a point where we could not slow it down, we could not stop it or anything. So it just continued progressing. So fortunately for her, or unfortunately, as the case may be, she from when the thing started, she died not so long after. I think that same day from the first development, because we saw the progression of that mucormycosis of the faces. That the progression was going to be, it wasn't going to be palatable for like her relatives to see her in that state. Even in the state that she was already, it was already not good to look at. But the way it was going to progress to was not going to be good. That's why I feel like abuse of corticosteroids, it needs to be slowed down on, because even when corticosteroids are given therapeutically, like when they are given, like, okay, they have a role to play, it's usually controlled, and the dose usually falls progressively. So
Yes.
usually
Tapered doses.
Yeah, it's always tapered doses. So using it and then increasing the dose, corticosteroids have a negative effect of dampening your immunity too.
Yes.
They also like
Yes.
reduce your immunity once you're just using it haphazardly, or using it a lot, as the case may be. So it's why you have to, when you want to use corticosteroids, it has to be a practitioner that would give you that dose.
Yes.
And it's also going to be a tapered dose, like goes down slowly till you don't have to use it. So abusing it is not advised. Of course, the example I've given is the worst case scenario,
Yes.
of course, but it is still a drug that you should be very careful to use.
Wow.
Yeah.
Thank you so much, Dr. Tio. I mean, you've really enlightened us. Now, before we end the podcast, I just wanted you to just share with us what are the basic steps one should take if you are identifying that you might have an allergic reaction, or better still, if you are a parent, because most of the time, in my line of work, I've discovered that a lot of times the people that I've come across are parents that their children are either having certain reactions, they have very severe cases of asthmatic reactions, or cases of reactions on their skin. Yeah. So what are the steps they should take? Because, now that we are on this platform, we don't want people to just go and self-medicate. Neither do we want them to just go on Google and search for things and start having imaginary symptoms and then go to the pharmacy and take medications that might not properly address the issue on ground. So from like step 1 to like step 4, can you just guide us on what are the things they should take or do so that at least they will have a better outcome for their condition?
Okay, thank you very much for the question. So, as with everything regarding health or regarding any ailment that a person has, identifying it is usually the first point of call. So, in terms of identifying an allergy, you have to understand that, okay, when this happens, why do I feel this way when this happens? For instance, there's some people that have allergies when there's a change of weather. So, for instance, if for me, once pollen starts falling from the sky, or pollens are in the air, I usually have itchy eyes, in the case, as the case may be. So you have to first notice the symptoms like itching of your skin, maybe hives. Hives are reddish discoloration of your skin. You can start having watery eyes or itchy eyes. You might start the worst case scenario, you might start like having choking feelings or choking sensations, of course. But those ones involve things that you put inside, ingest inside your body. So to identify, you have to understand, okay, what came before how I had this, when I had this feeling, what came before this, how come I feel like this every time I take this thing. You have to narrow it down, as the case may be, because allergens are usually difficult to pinpoint. But immediately you have these symptoms after something happens, or once you notice a pattern, always proceed to your healthcare provider. So when you get to your healthcare provider, there is a test that has been formulated recently, the RAS test.
Yes.
So they can do that to see, okay, if you have an actual allergen to allergic reaction to something.
Yes.
So that will be done. So once that is done, the healthcare provider can always provide a solution regarding that, maybe medications to take or what to do immediately you have these allergic reactions. You already talked about the parents that had the phenylephrine or the hydrocortisone for some people too. That is like a quick acting resolution to any allergic reaction that a patient might have. So those are the ways, those are the steps that you can take. Identification is the most important part. To know, okay, I might have an allergic reaction. So you then go to the hospital to confirm if you actually do. And then treatment can also be placed regarding this.
Yes, fantastic.
Yeah.
So, like Dr. Tiwa said, you must identify that you even have that condition. Seek a medical practitioner's professional help. Then you have to run a test. Then, of course, in that case, once you are aware of what the allergen is, then the medications and then the things to avoid must be the things that you have to now start imbibing by. Then, one thing that has also come to my mind is that apart from just identifying the test, we also have to start raising awareness, even with guardians also, parents especially. The reason I'm saying that is that, for instance, let's say a parent is not really sure that the child has any allergy. But you know how children can be when they go to school and their friend shares something with them and the teacher might not even be aware, and not knowing that that thing contains a potential allergen that can put the child's life at risk. So we also need to start creating awareness, even with parents, that, okay, even if you are not sure your child has an allergy, but as Dr. Tiwa has already told us, that some things you should look out for, the itchy, you notice that your child always has itchy eyes, itchy throat, it has the inflammation on the skin. Don't just self-medicate. Ensure that you also inform the teacher that, okay, I notice some of these things on my child's body. So when it's playtime, maybe try as much as possible that the child should not be in the grass, because I don't know, I went to a boarding house. And I remember then in boarding house, there was even the time I was cutting the grass, and I just got that from that, it wasn't up to like 5 minutes. My skin, I started having like blisters all over my face. In fact, I had to be given an exit to go home. But the funniest thing was that immediately I was in the bus, the blister disappeared. So, so I was like, what will I tell my dad? That he'll be like, you this boy, you didn't want to, you're looking for a way to, leave school. But it was from there they discovered that, okay, that means that I should not be cutting grass. That maybe the grass at that point, maybe, I don't know. And that was how I discovered that I couldn't cut grass. Even though when I was in GS1, GS2, I had slight asthmatic condition, but that didn't stop me from still cutting grass. But that day, I just went there, cut the grass. So like you said, some of them, it's when you are exposed to the allergy, you discover that you are allergic to this condition. So that concludes our episode of Allergies on Circle Direct podcast. We believe that everything we discussed today was very informative and educative. So our viewers, we would love you to also drop any comment you want us to share on any allergen that you might have, or an allergen that you're suspecting but you don't know how to test it, or you don't know which area you might get help from. We'll always be willing to give you the very good information that will be of benefit to you. Thank you so much once again for tuning in. Do subscribe to our channel, like and share. And until I see you next time, have an amazing day.